All right, the heart is a very complicated in some ways system and easy to understand in the others. So we're going to do a quick overview, and hopefully by the end of this you'll have a pretty good understanding of the heart and what it does. So our objectives for this chapter are to look at the anatomy of the heart. We'll look at the shape, the four chambers, the different layers of the heart, and also the vessels that are leading in and out of it. A short slide on the muscle fibers, and then we'll talk a little bit about the physiology behind the heart. So first things first, the anatomy. It's about the size of your own fist, and it lies 2/3 of the way to the left side of your body. So the mid-sternal line is right down the middle, and the heart is at least 2/3 to the left. The base is the top, which sounds kind of counterintuitive, and the apex is the bottom, which points towards your left hip. So this is what it looks like in your thorax. So the base is up here where these vessels are connecting, and the apex is that point that's pointed down towards your left hip. The coverings of your heart are there's several layers. The first one's called the pericardium. So the pericardium is the thin see-through wrapping, and it's a double-walled sac. There's a serous pericardium and a parietal pericardium. And then sometimes this third one, the visceral pericardium, can also be called epicardium. So in some texts you may see that classified differently. If we blow up what that looks like, we have a three-layered system here. So this is the hollow part. This is the inside where the blood is. And then we have the muscular layer called the myocardium. The very inside or visceral layer right here. On top of that, there's a cavity. Then there's the other side of that pericardium that wraps around the parietal. And at the very outside, there's a fibrous layer of pericardium. So you can see there's lots of different layers, but really its only job is to protect it and cover it and keep all the other systems out. Alright, so as far as the chambers go, there's a right and left of two things. A right and a left atria, or atrium if you're talking about it singularly. Those are the two chambers that are receiving blood. The right and left ventricles are pushing the blood away. So they're pumping the blood out of the heart. Let's look at how they fit into this picture. So the right side of the heart is the patient's right. So remember, we're looking at the patient. So this is the right side. The left side is over here, the opposite of your left, because we're looking at the front of a patient. There's also the great vessels. These you will absolutely have to know. So there's a superior and inferior vena cava, the aorta, pulmonary arteries, and pulmonary veins. Let's look again at that same picture. The superior and inferior vena cava, here's a blue one on top, and the blue one that's pointed down towards the bottom. Those are both vena cava, and they're leading into this right atrium. From there, the blood rushes into the right ventricle, and then up and out through this pulmonary trunk, which leads to the right and left pulmonary arteries. The blood will then go to the lungs and return in the pulmonary veins from both the right and the left side. That blood will drain in from the lungs to the left atrium, then to the left ventricle, and then up and out through this red tube called the aorta. So make sure you get that through your heads. You'll need to know this for sure. If we open up the heart, you'll see the valves that it's passing through. So again, I'll go through that same pathway again. The blood is coming from your body through the superior and the inferior vena cava into this right atrium. From there, it goes to the right ventricle, up and out through the pulmonary trunk to the lungs. From the lungs, both the right and the left, into the left atrium, then to the left ventricle, and then up and around through this aorta, back to the body, and then the whole process starts over. So it sounds kind of long and complicated, but once you see where the four chambers are and know what leads in and out, it actually is pretty simple. So the pathway of blood is from the right to the left. The right side pumps to the pulmonary circuit, and pulmonary just means lungs, so the right side is pumping to the lungs. The left side is pumping to the systemic circuit, or the rest of your entire body, so all the different tissues. We have a cool diagram here. Sometimes this is helpful and sometimes people find this more confusing, but it's pretty simple if we walk through it. The right side of the heart, notice that it's all colored blue. Blue is deoxygenated blood. We're going to pump from the right side to the lungs. The lungs is where that gas exchange occurs, and we're loading up the blood with oxygen. Then we're sending it from the lungs back to the left side of the heart, up and around. The left side is pumping then to the rest of your body, where your body uses that oxygen and then sends the deoxygenated blood back to the heart. There are 4 major valves in the heart. The first 2 are grouped together because they are AV valves. AV stands for atrioventricular, so it's going from an atrium to a ventricle. There's one on the right, one on the left. The second 2 are paired up because they are both the same type of valve. They have these little cusps, and we'll see that in the picture. Let's look again at this picture. Here is one of the AV valves from an atria to a ventricle. Here's the other one, from an atria to a ventricle. And then both of the pulmonary valves and the aortic valve look like this. They have these little cusps that allow blood to rush up and through, but not back down. They get stuck if the blood tries to rush backwards. There's some good pictures in your book about the 2 different valves and how they work, so I would encourage you to look through that on your own. Alright, that wraps up the anatomy part. Let's talk about the muscle fibers. Cardiac muscles, some of these fibers are self-excitable, meaning that they can contract on their own. And the heart contracts as one whole unit or nothing at all. So you don't really ever have one group of heart cells pumping and the other one's not. That's not how it works in a normal functioning heart. Let's look at a microscopic level. You can see here that the cardiac muscle has these intercalated discs. That's different from any other muscle, and that's what helps it to be self-excitable and to send its own charge through all of the heart cells at once. There's also those gap junctions that are helping to spread the signal to contract very quickly. And a couple of the electrical events that are happening here are starting with those self-excitable cells and then sending it through the rest of the heart. And it goes in this order. This is important. From the SA node, that's like your pacemaker, to the AV node, then AV bundle, the bundle branches, and Purkinje fibers. So let's look at that through a picture. In the top left, the SA node is up in the right atrium. That's the very first signal. That's the self-excitable cells that send off that first message that, hey, rest of the heart, we have to contract now. So it's going to send its signal from the SA node to the AV node, which is still in the right atrium. Then we're sending that signal down the middle of the heart and branching it off to the right and the left side so that they can contract at the same time. We want both those ventricles to be squeezing. The electrical events in your heart are controlled by the autonomic nervous system. This is a system that we talked about already. So remember that sympathetic means to rest and digest. Parasympathetic means rest and digest. So it will slow everything down. And the sympathetic is the fight or flight response. So that means you would be increasing your heart rate and your heartbeat. All right. This part can be a little bit confusing when we talk about EKGs. This will be something you run into in your clinics. An EKG stands for electrocardiogram, and it's actually just monitoring all of those electrical events we just talked about. So the SA node, the AV node, and so forth. I'm sure you've seen something that looks like this from an EKG. If you look through this carefully, you can see exactly what's happening. So as the SA node is sending a signal, each of these signals is measured on this graph, so the peaks and the valleys. It's kind of a neat thing, actually, and if there's variations, you can tell what's going on. Here's a better picture of how it's related. So during the SA node, that's when you get this first bump, or the P wave. Once that signal is sent through the AV node, that's the little resting spot right here. And then this is the important one, during the QRS complex. That's when this signal is being sent to the right and left ventricles. So you get this spike. After that, your heart has to go back to its resting state. So the signal has been spread out. There's a resting piece right here. And now we're repolarizing or getting ready for that next heart beat. That message right here is being shown as the T wave on this EKG. I know it seems a little bit complicated right now, but if you really get your hands on the pathway of the electrical events, this will help so much. Okay, last couple things for the heart. When you're listening to a heart, you'll hear two sounds, a lub and a dub. And usually, if this is normal, you won't hear anything else. It'll just be lub dub, lub dub, lub dub, lub dub. And you're actually hearing the sounds are the closing of the valves. So when the valves are slapping shut, it's making almost like a slapping sound or a drum sound. And that's what you're hearing when you're listening through a stethoscope. If you hear abnormal sounds or murmurs, that's usually turbulent backflow. So that means that the blood is going through the valve, but then it's kind of sneaking its way back the opposite direction when it shouldn't be. So if the valve hasn't closed completely and blood is leaking back through, that can cause some extra heart sounds, which are abnormal. All right, quickly, the cardiac cycle. We know that there's a series of pressure and volume changes. Systole is the contraction phase. Diastole is the relaxation phase. So that means the higher number is the contraction, and the lower number is when the heart is relaxing. So when you're measuring a blood pressure of 120/80, that means that the systole is the contracting part, and the diastole, the 80, is the heart relaxing. Okay. I would encourage you to take a look at this slide, especially if you're having trouble putting everything together. And there's one more slide right here that I would encourage you to blow up and look through and make sure you're getting it, because this is just super cool. It tells you exactly what's happening, where the blood is in the heart, which valves are open, the volume of blood in the heart, the pressure, and the EKG all at the same time. So everything that's lined up vertically is happening at that point. And it really helps you to put all of those concepts together. So make sure you pull up this PowerPoint on your own and look at this slide to help tie all of these things into one concept. And as always, if you ever have any questions or you want to talk this through, let me know and I'd be happy to help you out.